The first thing that I'd like to do is to ask the members of our group to stand, if they wouldn't mind. We had a great group, and I'd like to give a little recognition for them. Our purpose in attempting to deal with the evidence synthesis is very similar to the processes that were described by other groups. I don't think that there's very much that's unusual that you haven't heard already. We needed to assess the evidence that that was assembled and review it in relationship to efficacy, effectiveness, and sustainability were our basic criteria that we were attempting to include in this review, and I'll talk about that in a minute as a challenge for us. And also, importantly, the studies that we looked at, for the most part, were based on low and the experiences of low and middle income countries, research, evaluations, great literature that was available for that setting. The process to result in policy, practice, and research recommendations that Philip is going to talk about in a few minutes. Like everyone else, we were working with four populations, four vulnerable populations, children residing in institutions, children in and of the streets, children involved in conflict and natural disasters, and labor and sex trafficking. And our focus ended up being on infants through children ages 21 through 24, and I need to just be clear that at least for many of the federal agencies that are involved, the mandate is to work with children up to age 18. But I think that we find that the evidence suggests that, at least in terms of transitioning issues and reintegration issues, that the age groups may need to be extended a bit more. This is also heartened, I think, a little bit by the presentation on the neural science, that a significant amount of development also occurs in some of those later ages, sort of reinforcing, at least from my perspective, the need for us to be attentive to that. On the issue of quality, I think the thing that we had the most difficulty with was assessing the quality of the research, particularly using the criteria. We found that there were some stronger studies, for example, that were focused in very narrow regions or very narrow populations, and that the quality of the criteria that we established wasn't necessarily always appropriate. You'll see when I present the framework that we're trying to deal with a fairly broad way of organizing principles and some of the types of research designs that result from efforts to be very rigorous in terms of things like comparison groups and random control trials may not be as applicable for some aspects of the framework. And so to get to that, our framework essentially is one that we wanted to address as a systems perspective. So our effort was to try and reorganize the literature that we were charged to look at in terms of a systems perspective. This is sort of a growing approach to try and address some of the siloing, some of the needs for coordination, but I think also the recognition that the populations that we're talking about overlap quite a lot, and overlap in terms of their trajectories, in terms of their status and vulnerability. So our four categories include policies, legislation, and regulation. So we're looking for evidence regarding the efficacy, sustainability, effectiveness of policy, legislation, and regulation. Obviously challenging from the perspective of fitting into a more normal research perspective. Structures and functions of systems, which we were defining as the range of system activities, the interactions that create structure among the activities, and the resources available to support them. The continuum of care and services is the other ingredient of the systems framework that we were looking at, and data and information for decision making. We looked at about 64 different pieces of research collectively. I have to say that I think most of the information that we found was in the third category, the continuum of care and services. Not a lot of information, at least we reviewed, in the other categories. So speaking of legislation and policy, I think the overarching framework, and I guess the other thing that I forgot to mention is that throughout this process of literature review and the attempt to synthesize it, we were trying to look at this from a cross-cutting perspective, recognizing that while there are differences developmentally and in terms of issues with respect to what systems people come into contact with, children come into contact with, that there are differences, but that there were a lot of, in our view, cross-cutting issues that we needed to try and emphasize in terms of thinking about a systems framework. So a major cross-cutting issue for us, for example, was permanent family care and the importance of emphasizing a continuum of care in terms of desirability and impact. So ranging from reunification, adoption, the Islamic kafala system, kinship and best options, and then issues that are related to duration of care and timing of care. The specific types of things that I think we focused on with respect to legislation were things like registries, birth registries, the need to have legislation that supports reintegration and independent living, and especially for children in and of the streets, for trafficked children, effective and sustainable national responses, and for conflict and disasters, complementary tactics, I guess, on community and international approaches, and an effort to try and mobilize communities. And we'll talk a bit more about that, I think, from the standpoint of rural communities in particular. There's some evidence that a professional child welfare system is cost-effective, particularly in the context of family care as opposed to institutional care. So as a cross-cutting perspective, that seems to be one that's relatively important. Another one that's related to that is workforce development and legislation that supports workforce development to address a lot of these issues. Again, the evidence for much of this is very sparse, and I think that Philip will talk about the need to beef that up. For system structures and functions, again, the issue of workforce comes up. While it's duplicated from the standpoint of legislation and policy, the issue here is what's the real infrastructure that's going to be developed at a country level that is actually going to support the development of workforce? What are the educational systems that need to be in place? How are people not only trained, but provided with the types of experiences and exposures to the populations that they need to work with? And how is that sustainable within the context of a given country's setting? With respect to systems and functions that apply to the subpopulations themselves, issues that are related to providing educational systems, particularly for children in and of the street, that seemed to be an effective approach, both with respect to basic education as well as vocational training. Some, vaguely associated research that would suggest that simply dealing with the availability through fee elimination isn't necessarily going to be effective in promoting that type of service. With respect to trafficked children, referral systems, for example. And I think that we've the sense that referral systems more generally are needed for most of these populations. So even though we have evidence from that particular vulnerability population, in our view, it seems that that's something that might be something that could be important from a systems perspective for other populations as well. Another major issue is how do you go about dealing with the approach to reintegration, employment opportunities, and how do you deal with issues that are related to stigma with respect to certain types of populations? How do you develop an ethic that makes stigma less of an issue in terms of reintegration issues? For services and intervention, which as I mentioned, I think the largest single category that we looked at, an overriding issue for us was the need to pay attention to culture and some of the shifting contexts as different countries and regions undergo certain types of changes. The evidence that we found seems to suggest that attention to that is a real crucial part of the development of programs and services. When it comes to the development of approaches that are friendly to families, that encourage the development of family-related relationships, the movement that was described earlier along that continuum, to more reunification, to the use of kinship care, there's a need to begin thinking about family engagement strategies, and some evidence that family engagement strategies, like family group decision-making, for example, might be effective in terms of presenting opportunities to work through issues with families to allow children to either reunify or to find strong permanent relationships with kin, for example. The other thing I think that is important to mention here is that along the continuum, that the quality of care is really a critical issue. That it's not just family care versus institutional care, but that under certain circumstances, it's very important to think about the applicability of a particular type of setting for the needs of a particular child. And is that setting actually going to be a high-quality setting where they can potentially thrive regardless of some of those needs? For example, from an institutional perspective, it may be important to look at the needs of children who are disabled and the ability of those institutions to support disabled children. Even here in the United States, roughly 15 to 20% of our children are in institutional care. These tend to be older children and children who have disabilities of various types. But the criteria vary, and the thresholds for entry into institutional care here vary. But it's part of a broader system designed to meet multiple types of needs along some of these continuums. Let's see. Another, I think, important type of continuum that we identified was the 5 common components for street youth intervention, including issues that were related to framing and presenting the problem, providing information, building coping skills, building social support, and addressing environmental barriers. I'm hoping that some of our group may be able to make some comments about the efficacy of these systems in a variety of different types of country settings. And finally, with respect to traffic and labor issues, rehabilitation and reintegration research suggests that in many cases, perhaps if not most, children can return to families of origin. But there's a critical issue of ensuring that safety is maintained. And in some cases, that type of reintegration may not be possible. So again, looking at service delivery systems that take individual needs and circumstances into account are quite critical. Lastly, in terms of data and information for decision making, cross-cutting theme for us, of course, is that evaluation applies to all of these different populations and to the systems that I think can support them. But there's a need, however, to focus on particular methodologies, and we heard some of this yesterday from focal question 1, that are specific to issues of enumeration, for example, and issues of methodology that address hidden populations as well as populations that may be more visible in systems. And that there's a variety of methods that need to be used, and multiple methods are really appropriate for looking at these populations. Finally, even though we have some sense that these populations overlap, we don't really have very much information about that. To begin to look at how some of these approaches might be melded, I think is ultimately important. Leading a little bit into Philip's presentation here. That is, I think, the extent of what I wanted to say about the nature of the paper, except to say that, again, what we're trying to do is to think about this systemically, in as cross-cutting a way as possible. We think that ultimately that's the approach that's probably going to be most useful to us in terms of designing a more comprehensive approach to addressing the needs of these children. So thank you.
So we're going to open it up for comments or questions or thoughts about that presentation. While you're thinking of those, I wanted to ask you, you said child welfare systems are cost effective. What did you find in the evidence around that?
Mostly this had to do with the work that's been done on institution, or the comparison between institutional and foster care approaches. And it may be that others in our group would be more prepared to comment on the specifics of what some of those studies found. But I think that we have some sense that indeed providing services in that context is more cost effective. But issues of quality and issues of workforce development are obviously key and critical.
Anybody from their group want to comment on that or thoughts about that? Because it seems like an area that needs a lot more discussion about what we need.
Right, and I think the other thing, again, to point out is the evidence base that we looked at for these issues is really very sparse. We didn't find a lot supported any particular statement of evidence that I just presented.
Other thoughts, comments? Go ahead.
I'm just here, I'm Jean Guerin from Incorporated. I'm wondering if you saw any examples or models of referral mechanisms that you talked about that at a national level or even a regional level that was able to be kind of a neutral player in placements and decisions about who's trafficked, who needs to go where, who needs to be reunified, and making the best interest of patients. I think that's hard because we have so many different actors. You have the government, you've got different NGOs, but there needs to be collaboration on that, but also a neutrality in how those referrals are made. So I wonder if any of the evidence shows some examples.
Yeah, and the examples, I think, primarily were more related specifically to trafficking, in terms of the nature of that as a fundamental part of the initial process for working with children. I think identifying these cross-cutting again, fine or not.
The other thing that came up that was a word that was not mentioned almost at all yesterday was the word education. And I was wondering what you saw in the literature that was related to their long-term education needs, or is that an area that needs to be looked at?
Again, there are probably two sort of key populations that we were looking at. One was the children in the streets, where having access to educational services was viewed as important in terms of being able to provide reintegration for children. Other issues had to do with more concerns about whether educational approaches could be effective. The absence of jobs, for example, in rural areas might not necessarily would serve as a barrier in the event, even if you had educational programs for children. The solutions that might be available without being integrated with other types of solutions may not be effective. So that was some of the kinds of things that we looked at.
Go ahead, Linda.
Hi, I'm Shannon Seneff. I'm with Catholic Relief Services, and I'm also a child psychologist. I'm just wondering, it seems to be an overarching need for services on psychosocial counseling. I was just wondering what kind of literature you found on that, and if there were any recommendations for how you actually provide those services, or what different policies might impact the provision of those services.
I think for that, I might want to refer to some of the other members of our group to provide perhaps some insights into that. If there's
Who else in that group?
Susan, would you have any?
They moved it.
I think it's a great question. I don't think there's much evidence on it. I can share some information that I received from the director of an institution in Russia that served orphaned girls and boys ages 16 to 19. There are about 100 kids in this institution. And I asked her, actually some UNICEF visitors were there with me, I asked her about what percent of the kids end up making it. And making it means having a job and a place to live, and she said 20%. And I asked her, have you ever seen a year where this has been different? And she said, I saw only 1 year where it was different. And I said, well, tell me about that year. What happened that year? She said, well, that year it was reversed. That year we had 80% make it and 20% not make it. And I said, okay, so what's the difference? And there was an anti-trafficking organization that had provided a psychologist twice a week for every kid in that institution during that 1 year. And she said after that 1 year of intervention, those kids who left seemed to make it. Now, I said, is there data on it? Of course, no, there's not. Did anyone continue it?
No, it was a one-time project funded by a nonprofit, and it stopped once the project funding cycle stopped. So I don't know of any data. I think it's an important area. I do know of that one anecdote.
Great. Go ahead. This is a great summary and a review of the literature. One of the concerns that I have, though, repeatedly listening to it, is we got a kickoff yesterday by Jack Shunkoff, which really framed what we're trying to do in the context of healthy development. And in fact, there have been 2 big series in the Lancet, both of which have looked at vulnerable children, not from the perspective of homeless youth or trafficked youth, but from healthy development in low and middle income countries. And they really focus on relationships, on many of the education, but the one that we haven't put up on the board the last 2 days is physical health. And I thought Jack's argument yesterday morning that basically it's your destroying the brain. Your inaction fails to have opportunity for economic development and for physical health development. That if we grounded some of our work in that perspective, it aligns us with major donors on maternal child health right now, and it begins to, just as you said a few minutes ago, you have relationships, you have psychosocial, you have physical, you have education. If we think in really big blocks, I think our interests are more aligned with what's going on rather than, I do psychosocial research, and basically most people at NIH think we're like fringy, not important. The big things are going to be in micronutrients and biomedical innovations right now, and I think we need to ground our arguments more in those biomedical innovations.
It's a great comment, and it's cross-cutting across the vulnerability groups. Any comments? Or Dr. Nelson, this might be your cue here to have a comment.
You want me to comment on what we talked about before, or comment on that?
Either, or both.
Well, I wouldn't say destroying the brain. I wouldn't say destroying the brain. Altering the brain would be a better way to put it. The way I would put this, there are 2 points I wanted to make yesterday, and I'll be really brief. We can't assume that all forms of early adversity behave the same way. So trafficking, street children, orphanages, and child soldiers, they all represent horrendous forms of adversity, but the brain will respond differently to them based on the nature of the adversity and the timing of the adversity. So I think we need to be careful and not assume that all this will funnel into the same pathway. It's likely to funnel into atypical developmental patterns, but not the same pattern. So I think that we have to be a little bit more cautious in not assuming that all forms of adversity lead to the same outcomes. And the second is timing is everything, and this is sort of a theme embedded in some of the things that we've said over the last day or two, which is that we need to pay close attention. If we're going to understand what shifts development in one direction or another, we have to understand not just the nature of the events, but the timing of those events. And the reason for that is simply the issue of sensitive periods in brain development. So depending on the maturation and state of the brain at different points in development, that will determine what the outcome is. And that speaks to the issue that arose yesterday, which is that institutionalizing a 10-year-old who's spent the first 10 years living with a family will have a very different developmental outcome than institutionalizing a newborn who's never been in a family. So that has to do with the issue of the timing of brain development. We have to assume that in all cases of this adversity, there are multiple levels that are influenced, and you commented on this in the beginning of your talk, so that it's going to be affected at the at the cellular level. So an example of that is that we know that chronic stress, what Mike Bruce McEwen refers to as allostatic load, can shorten the tip of chromosomes referred to as the telomere region. I know you're all getting PTSD from high school biology now, but it can shorten the telomere region, which is probably implicated in lifespan. So middle-aged women who take care of kids with chronic disabilities have lost the equivalent of 10 years of telomere length from the stress of taking care of those families. And we've shown in Romania that our institutionalized group has shortened telomeres. So there's effects at the cellular level and at the circuit level and at the structural level. Again, in our kids in Romania, we now know that they have smaller heads, less brain activity, which Jack showed, and now we know from MRIs that they have less brain. And then of course there's the behavioral instantiation, and then to speak to wherever she went, who was just up here, her comment a moment ago, we absolutely need benchmarks at the level of behavior. I mean, we can do all the biomeasures we want, but if we can't ground it in behavior, it's going to be really tough to interpret those biomeasures. So we really need both to go on hand in hand. Did you have anything else in mind for me to say?
No. That was...
All right, I overstated. Okay, thank you.
Thank you. Go ahead, John.
Two thoughts. First, just following on that, I think it's a good point about need to focus on development and the developmental outcomes, say, of someone who enters institutional care or maybe moves onto the street or in another situation at age 10 is going to be different than, say, a very young child moves into institutional care. But I think the issue that continues to be raised about the developmental perspective is extremely important and valid for those older kids. It may be different aspects of development that need to be given the attention. And I think maybe it's a statement of the obvious, but that for older kids, their social functioning and connections are going to potentially be impaired in those various situations. So I think that's an area that we need to really be paying attention to and doing research on with kids entering care or moving outside of family care at older ages. The second thing, I really like the structure of this paper where you have moved out of the silos. I mean, recognizing that a lot of the literature is from those silos, but you've approached it in a new way. I think that was very constructive. I think it's clear that what's done in terms of immediate care that we were more focused on yesterday, there are implications for longer term, and it's a bit arbitrary to just sort of separate the two, as we found difficulty doing. And I think it's worth considering the potential of merging the second and third paper. Philip had mentioned this idea to me that anyway, I think that we should explore that possibility. I think there's a fair amount of overlap, and I think it potentially could be one stronger unit by putting them together.
I think that's something that, in reading the Focal Question 2 paper that I agree with, that the overlap is significant. Obviously we didn't really touch on prevention, which may be one distinction, but on the other hand, once sort of out of that realm, I think the overlaps are significant. And it's really just a case of how do we sort of meld the structures in a way that makes sense for what we're trying to portray.
So does that mean the short-term and the long-term needs are coming together?
Well, it's hard
to separate them.
It's just hard to separate.
There were things yesterday, prevention, that assessment didn't get as much attention, so maybe we could pull that out. Other comments before we turn to your individual green cards. I think what's clear is the thinness here of the evidence. And so in making your recommendations on your green cards individually, if you could really think about where's the next step on the research, and what are your recommendations around that? So let's take, obviously, and policy and practice, but particularly around research. Let's take 5 minutes to do that. Thank you.